Go to the nearest mirror right now, lean in close, and look carefully at your own eyes. Look at the colored ring of your iris, the part that gives your eyes their color, and look at the very edge where that color meets the white. And while you are there, look at the soft skin of your eyelids, just near the inner corner by your nose, because hidden in those two small places, your body may be quietly leaving a clue about something happening deep inside your blood vessels that you cannot feel and cannot see any other way. High cholesterol gives almost no warning. There is no ache, no pain, no signal that anything is wrong. But in some people, the eyes do something remarkable. They show it on the outside. And once I show you what to look for, you will never look at your own eyes or your loved one's eyes the same way again. I am Dr. Daniel Mercer. For more than 18 years, I have practiced internal medicine, and I have spent those years reading the small signs the body leaves on the surface, the quiet clues that point to bigger things underneath. The eyes are one of the most honest windows we have into your health. So if you are over 60, if anyone in your family has had heart trouble, or if it has simply been too long since you had your numbers checked, then I want you to stay with me for the next few minutes, because what I am about to show you is simple. It is something you can check tonight, and it could be the gentle nudge that sends you to your doctor before a problem becomes a crisis. Before we go any further, if you find that clear, honest health information explained in plain language is helpful to you, please take 1 second to like this video and subscribe to the channel. It truly helps me reach more people who need to hear this, and it costs you nothing at all. Now let me tell you about a patient, because his story is the reason I made this video. I will call him Frank. Frank was 64, a retired school teacher, and he came to see me about something completely unrelated, a sore shoulder. As we were talking, I noticed a thin, pale, grayish ring around the colored part of both his eyes, right at the outer edge. I also noticed 2 soft, yellowish patches on the skin of his upper eyelids, near his nose. Frank had never thought twice about them. He assumed they were just part of getting older. But those 2 signs together made me pause. I asked him when he had last had his cholesterol checked, and he could not remember. We ran a simple blood test, and his cholesterol came back high, much higher than either of us expected. Frank felt completely fine, no symptoms at all, but his eyes had been trying to tell us a story for years. We were able to start helping him right away, working together with simple changes and proper care from his own doctor. Frank likes to say his eyes saved his heart. He tells me now that he made a habit of mentioning those eyelid patches to friends his own age, and that 2 of them went and got tested because of him. That is the kind of quiet ripple a single clue can start. And that is exactly why you are here today. So let me explain what is really happening, because once you understand the why, the signs will make perfect sense. Let us start with cholesterol itself, and I want to clear up a misunderstanding right away. Cholesterol is not your enemy. Your body actually needs it. Cholesterol is a soft, waxy, fat-like substance, and every single cell in your body uses it. It helps build the walls of your cells, it helps your body make certain hormones, and it even helps you make vitamin D from sunlight. So cholesterol is not poison. It is a building material your body cannot live without. The trouble begins only when there is too much of the wrong kind floating around in your blood. Think of cholesterol like delivery trucks moving along the highways of your bloodstream. Some of these trucks are helpful. They carry extra cholesterol away and out of your body, keeping the roads clean. But another kind of truck tends to drop its cargo along the way, leaving soft, greasy deposits on the inner walls of your arteries. Over many years, those deposits build up, narrow the road, and stiffen the walls. Doctors call this process atherosclerosis, but you can simply picture grease slowly clogging a pipe. The pipe gets narrower, the flow gets harder, and the pressure builds. And here is what makes this so quietly dangerous. This grease does not build up in a day, or a month, or even a year. It builds up over decades, a thin layer at a time, completely silently. There is no ache. There is no warning bell. A person can carry high cholesterol for 20 years and feel absolutely wonderful the entire time, never once suspecting a thing. That is why so many people are caught off guard. The first symptom of high cholesterol for far too many people is a heart attack or a stroke. That is a hard truth, and I do not say it to frighten you, but to explain why a silent clue you can actually see is so precious. If your body is kind enough to leave a sign on the surface, you want to know how to read it. Now here is the part that matters for your eyes. That very same waxy cholesterol that builds up inside your arteries can also settle in other places where the tissue is thin and delicate. And two of those places are right on your face, where you can actually see them. So your eyes can become a kind of preview window, showing on the outside what may be happening on the inside, deep within blood vessels you will never lay eyes on. Let me walk you through exactly what to look for, one sign at a time. The first sign, and the one I want you to look for most carefully, is a pale ring around the colored part of your eye. Doctors call this corneal arcus. Picture the colored circle of your iris, and now picture a thin ring, a soft halo, forming right at its outer edge, where the color meets the white of your eye. This ring can look gray, it can look white, and sometimes it can have a faint bluish tint. It usually starts as a small arc at the top and the bottom, and over time it can grow into a complete circle all the way around. That ring is made of fatty deposits, mostly cholesterol, settling in the clear front window of your eye. According to the American Academy of Ophthalmology, this ring is itself harmless. It does not hurt, it does not affect your eyesight, and you can see perfectly well through it. But, and this is the important part, the meaning of that ring depends on your age. If you are in your 50s, 60s, or older, this ring is extremely common, and it is usually considered a normal part of aging. In fact, the medical name for it in older adults is arcus senilis, simply because it tends to come with the years. For most older people, it is nothing to fear on its own. However, when this same ring appears in someone who is younger, say under the age of 40 or 45, that is a different story entirely. In a younger person, that ring can be a meaningful warning sign of high cholesterol in the blood, sometimes even an inherited kind that runs in families. So if you have a son, a daughter, a niece, or a grandchild in their 20s or 30s with a gray ring forming around their eyes, that is absolutely worth a conversation with a doctor and a simple cholesterol test. The age is what changes the message. The second sign is on the skin, not in the eye itself, and it is one of the most telling. Look at the soft skin of your eyelids, especially the upper lids, right up near the inner corner close to your nose. You are looking for soft, flat, or slightly raised yellowish patches or bumps. Doctors call these xanthelasma. They are smooth, they are usually yellow or cream-colored, and they often appear on both sides, near the inner corners of the eyes. These patches are deposits of cholesterol that have settled right under the surface of the thin eyelid skin. They do not hurt. They do not itch. Many people have them for years and simply think of them as a cosmetic blemish, never realizing they could be a clue. Now, I want to be very honest and very careful here, because this matters. Having these yellow eyelid patches does not guarantee that your cholesterol is high. Research and the American Academy of Ophthalmology note that only about half of the people who have xanthelasma actually have high cholesterol levels, so please do not panic if you see them. But here is the wise way to think about it. These patches are a flag, a gentle reminder from your body that says, it would be a very good idea to get your cholesterol checked. They are a reason to call your doctor, not a reason to lie awake at night. They simply move the decision to get tested from someday to soon. There is a third place cholesterol can show itself in the eye, though this one you cannot see in your bathroom mirror. It is in the retina, the light-sensing layer at the very back of your eye. When an eye doctor shines a light and examines the back of your eye, they can sometimes see the tiny blood vessels there. In people with very high cholesterol or related problems, those tiny vessels can show changes, and in some cases, small flecks of fatty material. This is one more reason why a regular eye exam is so valuable as you age. Your eye doctor may quite literally spot a sign of a whole body problem by looking at the back of your eye long before you ever feel a thing. So a routine eye exam is not just about reading glasses. It can be a window into your heart and your blood vessels too. I want to pause on this point because I think it is one of the most overlooked tools you have. Many older adults skip their eye exams once they have a pair of glasses they are happy with. They think, my vision is fine, so why bother? But your eye doctor is doing far more than checking how well you read a chart. When they dilate your pupils and look inside, they are looking at the only place in your entire body where the small blood vessels can be seen directly without any surgery or scan. They can see signs of high blood pressure, signs of diabetes, and yes, signs related to cholesterol and your circulation. A good eye exam every year or two is one of the quietest, most powerful health checkups you can give yourself, and most people never think of it that way. Now let me talk you through exactly how to do this check at home, because it only takes a minute, and I want you to do it properly. Find a room with good, bright light, stand close to a mirror, or use a smaller handheld mirror so you can get right up to your face. First, look at your irises, the colored part. Follow the outer edge of the color all the way around, where it meets the white. Are you seeing a pale, gray, white, or faintly bluish ring or arc forming at that border? Check both eyes. Next, gently look at the skin of your eyelids, upper and lower, and especially that inner corner near your nose. Are there any soft yellow or cream-colored patches or small bumps? Take your time. Look in good light. You may even ask your spouse or a friend to look for you, because sometimes another set of eyes spots what we miss on ourselves. Let me also warn you about the common mistakes people make with this check, so you do not worry yourself for no reason, or, just as bad, talk yourself out of getting tested. The first mistake is confusing the normal aging ring with an emergency. Remember, in an older adult, that gray ring is usually just a part of aging, not a crisis. It is a reason to make sure your cholesterol is monitored, not a reason for fear. The second mistake is the opposite, brushing off a yellow eyelid patch as merely cosmetic and never mentioning it to a doctor. Do not make that mistake. Point it out at your next visit. The third mistake is assuming that because your eyes look perfectly clear, your cholesterol must be fine. This is the most important point of all. Most people with high cholesterol have absolutely no signs in their eyes at all. The absence of these signs tells you nothing. So clear eyes are wonderful, but they are never a substitute for an actual blood test. That brings me to the safety part of this conversation, and please listen closely. These eye signs are clues, not diagnoses. They are reasons to act, not labels to fear. The only way to truly know your cholesterol numbers is a simple blood test that your doctor can order, often after a short fast. So who especially should get their cholesterol checked? If you are over the age of 40, if you have a family history of high cholesterol or heart disease, if you have high blood pressure or diabetes, if you carry extra weight around your middle, or if you smoke, then please make sure your cholesterol is being checked regularly. The Cleveland Clinic and major heart guidelines recommend regular cholesterol screening for adults, with the timing depending on your age and your risk. And if you have a younger family member showing that ring around the iris early in life, please encourage them to be tested too. Whatever you do, never change or stop any medication on your own. Always work hand in hand with your own doctor, who knows your full health story. Now let me give you a simple, practical habit that can make a real difference. Once a month, when you are already at the mirror, take 10 extra seconds to look at your eyes the way I showed you. Make it part of something you already do, like brushing your teeth or putting in your eye drops. You are not adding a chore to your day. You are simply paying gentle attention to a window your body has given you. And if you ever notice a new ring forming or new yellow patches appearing, write it down and mention it at your next appointment. Your doctor will be glad you did. And here is a small bonus that stacks right on top of this. The very same habits that protect your heart and your blood vessels are the ones that help keep your cholesterol in a healthier range over time. Eating more vegetables, more beans, more oats and whole grains, and more fish, while moving your body with a gentle daily walk, all gently support healthier cholesterol levels. None of this replaces your doctor or your testing, but it works quietly in the background every single day in your favor. So checking your eyes is the alert, and these simple daily choices are part of the answer. Let me bring this all together for you now. Cholesterol is something your body needs, but too much of the wrong kind builds up silently inside your arteries over the years, usually with no warning at all. In some people, that same fatty material shows up where you can actually see it. Look for a pale gray, white, or bluish ring forming around the colored part of your eye, which is meaningful, especially in younger people. Look for soft yellow patches on the eyelids near the inner corner of your nose. And remember that an eye doctor can sometimes spot signs even deeper, at the back of your eye. These are clues, not verdicts. About half the people with the eyelid patches turn out to have high cholesterol, and many people with high cholesterol have no eye signs at all. So the single most important step is this: get your cholesterol checked and see your doctor. Your eyes can open the conversation, but only a blood test can give you the real answer. It costs you almost nothing to look. It costs you almost nothing to ask. And that one simple test, prompted by what you see in the mirror tonight, may help protect the heart and the blood vessels that carry you through every day of your life. If this was helpful to you, and you would like more simple, honest explanations of the signs your body shows on the outside, please subscribe and join us here. This channel exists to help you stay informed, confident, and in charge of your own health well past 60, and I would be honored to be a small part of that journey. Take good care of yourself. Share this with someone you love who needs to hear it, and I will see you in the next one. And one quick and important note before you go. This video is for general educational and informational purposes only, and it is not medical advice. The signs we discussed are clues, not diagnoses.